Hello friends, I am Dr. Karishma Dafle, fertility consultant Pune. So today we are going to discuss about the differences between an IUI and an IVF. So IUI stands for Intrauterine Insemination. Here, once the ovulation occurs, the husband's processed semen sample is injected inside the uterus. Whereas in an IVF, the eggs are fertilized outside the body in an IVF lab. So IVF stands for in vitro fertilization. The other differences include the form of medication. So, in an IUI, we can either give oral medications or we can give oral medications along with injections. But in IVF, we need to give minimum of 10 IVF injections for all the eggs inside the ovary to mature. Coming to the other differences like the timeline. In IUI, the treatment lasts for maximum 10 to 18 days. Whereas in an IVF, the treatment may last for 1 to 2 months. If you have excess embryos, you might go for a frozen embryo transfer even 3 years after your previous pregnancy. The other differences like in case if you are in need of a donor eggs, you can't go ahead with the procedure of IUI. If you want to go for donor eggs, in case you have multiple previous failed IVF attempts or your egg reserve is less, you need to go for donor egg procedure which is possible only in the case of IVF, not in IUI. Coming to the success rate of IUI is between 15 to 18%, whereas the IVF success rate jumps up to 65%. Coming to the other differences like the use of donor sperms. So we can use donor sperms both in IUI and in IVF. So we have the possibility of using donor sperms in case the patient has multiple failed attempts with donor sperms in an IUI, then we can proceed for IVF with donor sperms. The other differences like the multiple pregnancy risk is definitely high in an IUI if the patient has 2 or more mature eggs during her follicular studies and all these eggs have ovulated during her routine follicular studies. The doctor will inform the patient regarding the risk of multiple pregnancies in an IUI. Whereas in IVF, we are in a controlled environment. So the doctor might ask you if you want to go for a single embryo transfer or a double embryo transfer in case you want to plan for twins. So the option of multiple pregnancy is available in IVF, wherein maximum 2 embryos if inserted, you can go for twins. But in IUI, if there are 2 or 3 eggs which have ovulated, we can't control the risk of multiple pregnancy in an IUI. The other differences like surgery required. In IUI, there is no surgery required, nor an anesthesia is required. Only in few patients which are very anxious, we might go for procedure of IUI under anesthesia. But the risk of going for anesthesia in patients opting for IUI is very less. But in IVF, we do require surgery, which is known as egg removal or ovum pickup, wherein we give a anesthesia, general anesthesia to the patient for 10 to 15 minutes, and the procedure of egg removal is done transvaginally. Coming to the other differences, in case your partner is having any genetic disorder, the risk of passing that disorder will always remain in an IUI. But in an IVF, we can test the embryos prior to transferring. We can check if the embryo has any genetic disorder, and if the embryo has any genetic disorder, we can stop or we can halt the procedure of embryo transfer in such patients. So the option of genetic testing of embryos is available in IVF but not in an IUI. So the monitoring required for IUI is minimum, but the monitoring required for IVF is little more than the IUI timeline. For more such information, you can please subscribe to my channel. Thank you.